The awake rhinoplasty is something I've become very popular for. This is because I devised a very unique protocol that I also evolved over the years in order to give my patients the best results possible from their rhinoplasty while avoiding the need for general anesthesia. My top priorities are patient safety and comfort, as well as, of course, the top tier results. Now, there's a lot of misunderstanding about this. Since I've made this very popular, a lot of people have heard about it. Some surgeons are trying to scare their patients. When they're talking about awake, they're actually talking about IV sedation and Twilight, and there's really a lot of confusion about it. But rest assured, this video is going to explain everything that's involved and how we keep this procedure very nice, safe, and comfortable for our patients. So first, we have to understand the different levels of anesthesia. And you could really break this down into three separate levels. One is general anesthesia. This is where you're fully under, you have the breathing tube, you need a machine that's going to actually inflate your lungs and do the breathing for you because you are fully and completely under general anesthesia. And of course, that carries the risks that are associated with general anesthesia. The benefit is you go under and you don't remember anything about the surgery. The middle ground is this Twilight or IV sedation. This is what some surgeons misrepresent as awake. However, this is truly the dangerous one for rhinoplasty because when you're under IV sedation, you're partially under, and these IV medications that you're getting are enough to sedate you, meaning to relax you to the point where you may not be able to manage the back of your airway. And what that really means is you're so sedated that if stuff drifts down the back of your nose, it may go down the wrong pipe, as they say. It may go down and you can aspirate. So that truly is dangerous, and that is one we do not do. What true awake anesthesia is our patients are able to manage their airway, they're able to speak, they're able to talk throughout it. However, they feel very calm and relaxed. We're going to get into the details of how we do this, but basically, our patients get complete numbing around the nose area. We put topical numbing, then we inject numbing. We do give them some medications, oral medications, not IV, that are enough to give them a sense of relaxation and pain relief, however, not enough to put them under where their airway is not protected. So the true awake procedure that we do and this protocol that I've devised is safe because patients can manage the back of their airway. However, at the same time, some of the patients are so relaxed that they can doze off naturally. Now, when you doze off naturally, it's the same thing as when you go to sleep at night. When we sleep, we get mucus going down the back of our nose and throat all the time. However, we automatically swallow it because that swallow reflex is intact. So awake is safe for that reason. We do not get rid of that natural swallow reflex. So what can you expect the day of your awake rhinoplasty procedure? So our patients arrive at the office, and one benefit of having an awake procedure is you don't need to fast after the midnight the night before. So our patients are able to eat breakfast. They feel nice and excited. They feel full. Sometimes there's an excitement and a nervousness because they're having a surgical procedure. But we bring them back into our preparation room. And in the preparation room, first, I like to calm them down. I like to sit them down. I like to review the procedure. Sometimes they want to see the pictures. Sometimes we just want to go over our plan. We do our consent forms, which is a form that says, hey, we're doing this procedure and we agree that this is our surgical plan and we're going forward. We then proceed to do all these little prep things. First, we clean off the face. We put numbing on the nose over here. We put some numbing just inside the nostrils as well. I also like to trim the little nose hairs. Do not do that on your own. When I trim them, I put special antibiotic ointment, which is actually part of the prep because our noses are dirty and we like to get them nice and clean. Once the patient feels really nice and at ease, we also give them some medications. These are oral medications. They're anti-pain, anti-inflammation, and there's also a prophylactic, meaning preventative antibiotic, and a preventative anti-nausea medication. These are going to slowly kick in. This process takes anywhere between 35, 45, sometimes even an hour. We take our time. We want to make sure that our patients are prepped, ready, and at ease. So we give these medications. We see how the patients are doing. We check their vital signs. We make sure that they're steady. We then can give a little bit more of the relaxation medication, and we monitor our patients. We check in with them. We see how they're feeling. At that point, we're ready and we proceed to the operating room. As patients walk over to the operating room, they can walk on their own because, again, they're awake, they're calm, they're relaxed, they're comfortable, but they're awake. So we walk over to the operating room. We lay them down. We have a really nice, comfortable memory foam table. We have some memory foam pillows, and we have all these supports. We even use these cordless SCDs, which are compression devices that are used for general anesthesia, but for awake patients, they serve as nice little massagers around the calves. So we get them nice and tucked in. They're very nice and comfortable. At that point, we take all the numbing off of the nose. We clean off the area once again, and we start getting the patient ready for surgery. And what that means is we do our little markings, usually in the case of a rhinoplasty, just underneath the nose over here. And then we do the injections. When we do the injections, we use a very small needle. We'll sometimes use a little vibrating device that helps offset any sort of discomfort. You don't feel the needle. What happens with injections, if you've ever had a dental procedure, is you feel that little bit of pressure and almost a burning from the medication. But it's really subtle. Everyone is different. We have patients that don't even flinch because they barely feel anything. And we have others, and I like to be very honest, and I like to explain on the worst case scenario. The worst case scenario is when we do these injections, you feel that stick and burning sensation. It lasts for a few seconds. Again, a dental procedure would be the closest thing to this. It's a like really soft, quick burning sensation. And you feel it in a few little areas. We also do little nerve blocks on the side. A few seconds from a few sticks, once that is in, you do not feel anything. What almost every single patient describes right after is their nose feels huge. In fact, their nose and their lip feel huge. Not that they're huge, but because all the numbing makes it feel like they don't feel their nose. You can do whatever you want at this point. Sometimes I'll even show patients, if they don't believe me, I'll lightly kind of flick their nose and they go, wow. And it's always the same response. Wow, that is so weird, because they know that something was done. They felt maybe some sort of pressure, but they didn't feel any sort of pain.
I didn't feel
So
it.
at that point, they're nice and numb, and we do all our sterile preparations. We put all the sterile drapes. And at this point, patients are now numb. So they truly believe me that their nose is fully numb. And we're getting them nice and comfortable. And all the sterile drapes almost act like a little blanket where they get tucked in. And at that point, we go on and we start our procedure. Normally, as we're starting our procedure, the first incision is something that most patients are still apprehensive about, because they're like, well, okay, my nose is really nice and numb, but am I still going to feel it? We go in, we start making our little tiny incisions. We use our little scalpel there, and they don't even know that we've started. I frequently tell them, okay, we've started, we've now cut into the skin. And they go, oh, really? I thought you were just still cleaning my nose, because they do not feel any of this. And then we go to work. Patients don't feel anything. They know that we're moving around over here, but there's no sharp, there's no pain or anything like that. We go through the entire procedure like that. We lift up the skin area over here, and it's all the same thing. When we lift up the area over the bone, they may hear some scrapey sounds, which also are described as weird. But they're weird because they hear a sound. They may even feel a little vibration, but they don't feel any pain. So it's almost so odd to them that they're not feeling any pain while all of this is actually happening. Most patients describe this as a very unique and interesting experience, because they never imagined that they can go through a whole procedure like this while being awake and having such a transformation to the structure of their nose right in the middle of their face without having any sort of pain. So as we go through, all the cartilage and all the soft tissue stuff is very much the same. The part that everyone seems to be very afraid of is the bone breaking part. And I have another video explaining the bone breaking part. It's not really a break. They're more like sharp chisels. I make sure to keep my chisels very, very sharp, because the sharper they are, the better they cut. If you think of a knife going through something, it's going to cut more evenly. Same thing with chisels. We make little breaks here and on the sides. What patients expect from something like that is, I always tell them, knock on your little bone over here, and this is approximately what you're going to feel, and this is approximately what you're going to hear. You hear the sound, you may feel a little bit of pressure, but it's not the pain that you would imagine it to be. Also, when we're in the septum, the very back part of the septum, sometimes there's a pressure there, but again, everybody goes through it. They say, okay, I feel a pressure, but no pain. Throughout the procedure, if any of the numbing starts to wear off, what we can do is just add a little bit more. Now, you may feel a little bit more stinging just from the injection, but we try to keep up with it throughout the entire procedure so that we're injecting an area that's already numb and you don't feel that same level of burning. Some patients make it through the entire procedure without any re-injection. Others need re-injections every 45 an hour, but we stay up to date on this and we always make sure our patients are comfortable. We don't do anything if they are not comfortable. So that's pretty much the procedure in a nutshell. Once we're done with it, the benefit of this really after the procedure versus general anesthesia, we don't have to wait for you to wake up from anesthesia. We don't have to pull the tube out. You're pretty much ready. We put the splint on. Patients, we usually do a little video. Sometimes we'll give you a mirror to see your immediate results, these on-the-table results. And you can appreciate that right away because you're there. You're not out. You're not super groggy. In fact, by the end, people aren't really groggy. They're just kind of excited. They're done. They just went through their procedure and they're more excited. So you get to appreciate that immediately. We put the splint on. We do some icing. Everyone's a little bit different. Some patients, they're excited to get home. So from the moment that we're done, they want to be out the door. We, of course, make sure that we put some icing on. We go through all the instructions, but patients can leave pretty soon after the procedure. And that's pretty much our awake procedure.